Mr. President.
Senator from South Carolina.
Thank you, Mr. President. To change the rules, our friends on the left had to break the rules. Mr. President, we're here tonight because the Obama administration and our friends on the left needed a distraction. By invoking the nuclear option, leading up to tonight's vote on Nina Pillard to the D.C. Circuit, they are attempting to quiet a disaster of their own making. Please note that this is a court that will hear the ACA disputes. It was easy enough for them to paint a rosy picture of life after Obamacare, and for 3 years they did it, and they did their best to do so. But words can only go so far, and no speech will help the failed implementation of the monster they have created. Healthcare premiums for the average American family have already gone up by $2,500 since Obamacare has become law. Let's say that one more time. The average premium that an American family will have to face and then pay is $2,500. As costs continue to rise for middle-class Americans, the median household income has dropped by more than $3,600 under President Obama. So if you take $2,500, you add in the drop of income of $3,600, the difference for the average American household under President Obama's watch is significant. That doesn't even take into consideration the skyrocketing costs and the increasing deductibles under Obamacare. According to the Wall Street Journal, the average individual deductible for what is called a bronze plan on the exchange, the lowest priced coverage, is a $5,000 average deductible. This is 42% higher than the average deductible today of $3,589 that you would currently purchase in 2013. Tell me how this helps those in need. How does this help the most vulnerable in our society? The answer is simple. It doesn't. And so we're here tonight because Democrats need a break from having this pointed out to them again and again and again as newspapers, magazines, TV stations have been doing for the last several weeks. Folks in South Carolina, and I will tell you that in South Carolina we have about 4.7 million people. 600,000 or 700,000 folks do not have health insurance coverage. Let's think about that. 4.7 million South Carolinians, of which about 700,000 today do not have health insurance. But under Obamacare, we would hope that the number would go down, not up. It would go from 700,000 down to 600,000 or 500,000 or 400,000. There's over 430,000 of the 700,000 people are eligible for Obamacare. But the number's not going down. The number is going up because 150,000 South Carolinians have received cancellation notices. Let's frame that a little bit. We have 700,000 uninsured, of which 430,000 are eligible for Obamacare. And yet, instead of seeing the number of uninsured go from 700,000 down to 600,000 or 500,000 or 400,000, we've seen the number go up because 150,000 people have received cancellation notices. 150,000 South Carolinians have received cancellation notices. And so someone would obviously ask the question, well, how many folks have signed up for Obamacare in South Carolina? If 430,000 South Carolinians are eligible to sign up, we ought to answer the question, how many have signed up? As of late November, only 600 South Carolinians had successfully signed up for Obamacare. That means that under the implementation process of what some consider the solution to America's woes on health insurance, only 600 South Carolinians have been able to successfully sign up for Obamacare, even though 430,000 are eligible, 700,000 do not have insurance, but only 600 of them have been able to sign up for Obamacare. You know, when you think about those numbers, it reminds me of the fact that the challenges that we face with going through the process of seeing the D.C. court stacked to hear the disputes, part of the challenge we see is that Obamacare hasn't worked, so stacking the court seems like the most likely option for our friends on the left. When we started out having this conversation about Obamacare, we started having a conversation about those who are uninsured. And I think that every American in our country wants to see greater access to health insurance. But the vast majority of Americans do not want to see the government take it over. And now we understand why. In 2009, not 1999, but 2009, we had an estimated cost for the Unaffordable Care Act of around $900 billion. 2011, they came back and said, wait. I need to take another look at this. And the estimate came back at $1.8 trillion. So 2009, $900 billion, and in 2011, the number had already increased to $1.8 trillion, or 100% increase in the estimated cost of the Affordable Care Act. And now, in just 2 more years later, we see that the number could perhaps eclipse $3 trillion. And all we're talking about is the upfront price tag, the price of Obamacare on the front end, but we haven't delved into the actual cost of Obamacare, because most estimates say that on the back end of the Affordable Care Act, we're going to see a $7 trillion increase or addition to our debt. And we started in 2009 or 2010, 2009 with $900 billion, 2011, $1.8 trillion, 2013, perhaps over $3 trillion, adding $7 trillion to the debt, but that's not the whole picture. You see, families in South Carolina still have to struggle with finding access to affordable health care, and Obamacare is simply not providing the access. And so we see families like the Hucks, the everyday American family. Mr. Hucks loves his family. In Greenville, South Carolina, he loves his family. He spends 12 to 14 hours a day working hard as a financial advisor in South Carolina. And Mr. Hucks, unfortunately, faces the challenges of buying health insurance through Obamacare. And as he went through the process of trying to figure out what would happen, certainly he liked his coverage, but of course he can't keep it. Period. He can't keep it. He just cannot keep his coverage. And so as I was talking to Mr. Hucks, Jason Hucks, in Greenville just about 2 weeks ago, Jason currently has a Blue Cross Blue Shield high deductible plan. And I want you to remember the word deductible, so we'll come back and have a conversation about deductibles. He has a high deductible plan that covers him and his wife and their cute 2 little boys. So instead of having a conversation between Mr. and Mrs. Hucks about planning for the college education of those 2 fine young men, they're having instead a conversation about can they afford the health care coverage. So what's happened? Well, let's take a look. Their current plan, with a $10,000 deductible, costs them over $415 a month. To stay on the Blue Cross Blue Shield plan under Obamacare, Mr. Hucks and his family would have to pay nearly $1,000 a month, $895, almost $1,000 a month, more than doubling the premium. And they will see their deductible increase by 150%. So a deductible that was $10,000, it's pretty high, significantly high, would go to $25,000 for this young family of 4. That just doesn't seem right to me. It doesn't seem fair. We believe in fairness. But for those who are most vulnerable, having access to $25,000 before their health insurance company is able to start paying is quite a high price to pay. Digging into your savings account for $25,000 because Obamacare takes their $10,000 deductible, not the $15,000, not the $20,000, but the $25,000. This is simply not fair. This is not how we treat the most vulnerable in our societies by seeing their deductible go up by 150%. I simply don't understand. It's just wrong. It's not right. And even if they were willing to switch companies, he would still see his rates rise almost 75%, and his deductible would still rise from $10,000 to $12,000. No wonder they're trying to stack the DC courts. Because when you see a young family not planning for a 529 plan, not planning to send their kid to Clemson University or the University of South Carolina, but instead they're planning on tightening their belts because they have to have a budget. And making plans to not have a $10,000 deductible, but have a $12,000 deductible with a 20% increase in the deductible and a 75% increase in the cost. This is the effect of the Affordable Care Act. It becomes unaffordable for the average American family. As for a plan with copays, Mr. Huck says flatly, he can't afford to have a conversation about copays because a plan with a copay would skyrocket his premiums from $415 or so to as high as $1,200 or $1,500 a month. So instead of being able to go see a doctor and have a conversation and pay a 20% copay, instead of having the opportunity to do what many of us have been doing for the last decade plus, paying a $15 or $20 or $25 or $30 copay when you go see your doctor, instead of paying that, he has to first satisfy not a $10,000 deductible, not a $15,000 deductible, but a $25,000 deductible. Now, this is higher than $15. This is wrong. It is not right. Mr. Huck's family is an example of how it is not just premiums that are rising, but deductibles are going through the roof. This is painful for a family that should be planning for college, but instead of planning for college, no, they're planning to spend more money on their health care because the Affordable Care Act is so unaffordable. The New York Times recently quoted someone faced with this problem as saying the deductibles were so high, $4,000 to $6,000 a year, that it very much defeats the purpose of having insurance. Blank word. I wonder why we say that. Well, let's just think about it for just a minute or two. Think about a family. Think about a family who has a $4,000 deductible. What does that mean to your average family, where Americans are spending over 100% of their income? Well, what that means to the average family is that you've got to figure out how to pay $4,000 in visiting your doctors, getting your x-rays, having everything done at the doctor's office, getting your blood work done, before you satisfy your $4,000 deductible and before your health insurance plan starts paying. But under Obamacare, you would think that this number would go down. But it doesn't. It goes up. As a matter of fact, it goes up so quickly that in the first year of Obamacare, it goes from an average out-of-pocket expense of $6,350 to over $12,000 $12,000. Not $4,000, not $5,000, not $6,000, but over $12,000 of out-of-pocket expenses. And so I'm looking forward to the day that we have a serious conversation about free market solutions that would reduce the cost of health insurance and at the exact same time create greater access for the average person in America to afford a free market health insurance policy. That's where we need to go. That's where the conversation should be. But instead of having that conversation, we're having a conversation about deductibles jumping, $5,000, out-of-pocket expenses going up significantly. And what I should have said is that when you combine the out-of-pocket expenses and the deductibles, the out-of-pocket total for a year is the $12,000. The average deductible is a little over $5,000. We're talking about a significant taking from the average American family, taking their money out of their pockets in the form of deductibles, taking out of their pockets in the form of a copay. And God forbid that you actually go outside of the network. In many of these plans, we're talking about zero coverage out of network for ambulatory care. So you bear 100% of the cost. So don't travel to the wrong place with the wrong plan at the wrong time. You'll find yourself stuck without benefits. Because unfortunately, the ACA isn't affordable for most Americans. And we find that sad. But see, we think we're having a conversation about nominees here today, and we think that we're having a conversation about nominees because President Obama has somehow, some way been treated differently than President Bush and other folks. But the facts are simply inconsistent with the reality or the alternate universe that's being created on the left.
All post-closure time has expired.
Mr. President.
Majority Leader.